Welcome and thank you for joining us for Standards on My Mind, Continuous Quality Improvement in Georgia. My name is Mary Robinson Griffey, and I'm an administrative coordinator with the National Family Support Network, and I'll be your moderator for today's webinar. If you're joining us online, you may listen directly through your computer speakers. If you've joined via the phone number that Zoom provided, your line's been muted to minimize background noise. For those of you online, please note the link to the Dropbox folder in the chat. Here, you're going to see that there are some handouts available for download. In addition, you may put questions in the question section at any time. The chat section is open for you to include any comments during the webinar, but we ask that you direct all of your questions to the Q&A section of Zoom. If you're having tech issues, our live tech support will be here to help you. I will get to all of the questions at the end of the webinar, and if I'm unable to, someone from the National Family Support Network will follow up after the webinar. Today's PowerPoint, the handouts, and a recording of this webinar will be available on the NFSN website on the webinar Wednesday page this time tomorrow. When you exit the webinar, an evaluation will automatically appear on your screen, and we ask that you take a moment to complete this as it provides us with valuable feedback to inform future webinars. So now let's get an idea of who is on this webinar with us. Here you see how we've divided the nation into regions. I'm going to ask you to take a look at this map and see where you are. Now we're going to launch a poll so that we can see who is with us today. You could just take a moment to respond to that poll for us. All right, I'll give you a few more seconds to respond to that poll. All right, let's see those results. Oh, so as you can see from the poll, we have great representation from across the nation, with the greatest representation being in the South, followed by the Midwest, the West, and the Northeast. So thank you all so much for joining us today. Now we've got a couple of other questions just to help us continue that sense of who is with us today. The next one is about your affiliation. So let us know what type of organization you work for. Do you work for a Family Resource Center or perhaps a Family Resource Center network, some other type of family support program? You might be a parent leader or in education. Just take a moment to click on that poll for us. Okay, let's see those results. All right, so we've got great representation with almost every one of the categories being filled in today. Our greatest number would be with government, other, but we have some people here from Family Resource Centers, other types of family support programs. We have some people from early care and education, as well as education. And then in our different pockets of government, government child welfare, and government other. So thank you all for responding to that poll for us. And then our final question is about the level you're working at. Perhaps you're at the program or direct service level, management level, policy systems level. If you check other, please share in the chat with us what other you are joining us from. All right, let's wrap that poll up. Let's see who we have in our room with us today. Oh, great. So we have people from all of our categories: policy systems level, the program management level, a direct service level, and we have some other. Again, if you want to drop that into the chat and let us know what other area you're working at, we would be so interested to know that. And we really thank you for your participation in the polls, letting us know a little bit about the valuable work that you're doing. So to start our conversation today, we're going to start by sharing a little bit about the national network. And that'll provide you with a little context as we dive in. When it was founded in 2011, there were just 8 states that were green on this map. But over the last decade, the NFSN has quadrupled in size, and it now has 37 member networks. And that's 36 states and the District of Columbia. And that represents more than 3,000 family resource centers that serve more than 2 million people annually. Our newest members are Kansas, who joined in October, and Michigan, who joined in September. And it's very exciting to see these states going green. Our mission is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. Our vision, in short, is that this whole map that you just saw will be green, and that will ensure that all families will have access to quality family support services in their communities, and that they'll be provided by FRCs that are supported by strong networks. If you're one of those states that's not yet green, we would especially like to connect with you to discuss and learn about what is going on in your state. Now, I'd like to share a little bit about the work that the National Network does. Our first bucket of work is connecting and convening member networks to enhance their effectiveness, increasing connectedness amongst members for peer learning and mutual support. Our second area of work is promoting family support best practice and evaluation, raising awareness of what quality family support is and promoting a common language, standards, and evaluation of it through the national implementation of the standards of quality for family strengthening and support. And our third area of work is raising the visibility of the value and impact of family strengthening and support networks in order to strengthen and increase support for families. So here's a roadmap of our time together today. We'll take just a few minutes to look at the standards of quality for family strengthening and support, and then we're going to get right to the meat of our event today as we explore Georgia standards implementation. We'll follow that up with some Q&A. Again, if you can be putting those questions in the Q&A section, that would be great. We'll have those ready at the end of the presentation. Then we'll follow that up with some NFSN resources and opportunities and an evaluation. The standards of quality for family strengthening and support are designed to be used by all stakeholders, public departments, foundations, community-based organizations, and families as a tool for planning, providing, and assessing quality practice. They uniquely integrate and operationalize the principles of family support practice with the Strengthening Families approach and its research-based, evidence-informed 5 protective factors. They also create a common language and expectations across different kinds of family strengthening and family support programs, such as family resource centers, home visiting programs, and child development programs. The documents of the standards themselves, as well as all of the implementation tools, are available for free on the NFSN website. And we want to underscore that we are not selling the standards. We want everyone to have access to and think about quality work with families. So I encourage you to go to the website, hover over standards. You can drop down to overview, and that on that subpage is where you'll be able to download the standards. You can also navigate to the implementation page where you'll find access to all of the implementation tools. And I encourage you to check that out. The standards of quality were developed in 2012, adopted for national implementation in 2013, and were thoroughly revised in 2020. The revised version of the standards was issued in March 2021, and it reflects an enhanced focus on diversity, equity, and inclusion, and relevance for both the Canadian and U.S. contexts. The 5 core areas of focus are family-centeredness, family strengthening, diversity, equity, and inclusion, community strengthening, and evaluation. And here you can see over the past decade where the standards have been. On the left, you can see highlighted in blue on the map where the standards have been, and on the right are some of the statistics. We have over 14,000 people that have been trained on the standards from across the country and Canada. And we have over 100 trainers that are conducting these trainings on an ongoing basis. For more information and to learn more about the standards of quality for family strengthening and support, You can find a recorded Webinar Wednesday overview of the standards on our website by clicking on the Webinar Wednesday page and scrolling down under Core Webinar Wednesdays. There, you'll be able to access the PowerPoint, handouts, and recording of that webinar. So now, let's get to our presentation. I'd like to welcome Deborah Cheswood and Laura Griggs from the Georgia Division of Family and Children's Services. They'll be self-introducing themselves as they lead us in our presentation today. So take it away, Deborah.
Great, thank you, Mary. You can go to the next slide. So good afternoon, everyone. My name is Deborah Cheswood. I am the Deputy Section Director at Georgia's Division of Family and Children's Services, which is Georgia's Child Welfare Agency. We are the Prevention and Community Support Section, which is the section within our agency that is charged with providing primary and secondary prevention of child abuse and neglect. And also we have two federally funded adolescent pregnancy prevention programs. I'm here with my colleague, Laura Griggs, who will introduce herself later, but she is our Georgia Family Support Network state lead. And also in the audience today is our brand new section director, Karsten Hartman, who just joined us on December 1st. So we didn't thrust him in front of the camera today, but he is here attending with us. So welcome, Karsten. You can go to the next slide. So our section is, you see that first bullet there says we're fairly new to the agency. At some point, we'll probably have to remove that bullet, but in an agency that's been in existence for several decades, we are the newest portion of the agency. We used to be a separate government agency specifically for child abuse and neglect prevention. And in 2014, we were brought over to Georgia's Child Welfare Agency to create a continuum of prevention services. So we provide the primary and secondary, and then of course, the rest of the agency does the tertiary prevention and the intervention services. So in addition to federal and state funding streams that come to us to do primary prevention and secondary prevention, we also have the two federally funded adolescent pregnancy prevention programs that I mentioned earlier. And we see that as a form of child abuse and neglect prevention because we know that statistically teen parents are at greater risk for child abuse or neglect. And so those sit within our section. As of recently, our Promoting Safe and Stable Families federal funding was also in our section, but just recently got pulled out. And so it is no longer a part of our prevention section. And we provide no direct services in our work in our section. So we utilize the federal and state funding streams in order to contract with either local community-based organizations or statewide organizations to deliver the prevention services. Next slide. So our federal grant that funds this effort, which is probably many of you in the audience are also either the CBCAP state leads, or you are familiar with CBCAP. Maybe some of your funding comes from CBCAP if you are a direct provider. So that is the federal funding that we utilize that helps us support the Georgia Family Support Network initiative in our state. And so CBCAP funding is required funding. States are required to utilize that funding for primary and secondary child abuse prevention strategies. Of course, the Georgia Family Support Network, as being a member of the National Family Support Network, we work with family support and family strengthening organizations, and we also work with family resource centers, and those are obviously primary and secondary prevention programs. And so there was great alignment for us to utilize those funds to help support initially the development of the network itself, and to provide staff support and some funding for that network, which Laura will explain a little later on. And then this year to provide our first funding opportunity specifically for family resource centers. And we used CBCAP funds for that as well. We were able to use some of our CBCAP funds that came through the American Rescue Plan, which states got a pretty sizable chunk of money that they could use for prevention services from the American Rescue Plan. And since we got a pretty big piece in Georgia, we were able to use those funds to support the first Family Resource Center funding opportunity. Next slide. Back one more. Thank you, Mary. So the goals of the CBCAP funding and the requirements of the CBCAP funding are that the state leads collaborate and coordinate with state partners, that they the lead agency develops or promotes partnerships and collaborations with other federal, state, local, or private efforts, which intersect with the prevention programs and activities of the state, that the work should be anchored and connected to established prevention and promotion activities, and that we strengthen collaboration and coordination efforts to improve the relationships of those who are working to impact child maltreatment. And so all of those requirements of the CBCAP grantee are really in line with and we thought encouraged us to develop the Georgia Family Support Network and to promote the use of the quality standards in the contracts that we already had been doing even before we offered the first Family Resource Center funding this year. So we'll talk a little bit more about that, but we just wanted to share that that was our rationale. We see this as really being in line with the CBCAP funding requirements, and the purpose of those dollars is to support this work. Next slide. So we've already talked about this a little bit, but we, as I mentioned, we have a variety of federal and state funding streams. So we've talked about CBCAP. We also have some CAPTA dollars that come to us to help support some of the work that we do. The two federally funded teen pregnancy prevention programs, which is Personal Responsibility Education Program, or PREP, and the Title V Sexual Risk Avoidance Education, or SRAE. We talked about PSIF, and then we also get a state appropriation in our Children's Trust Fund, and a TANF appropriation. Next slide. So some of the programs and services that we have funded in the past include evidence-based home visiting, parenting education, programs that support linking, screening and linking parents to needed resources. We have some programs that we fund that are specific for working with families who have children with special healthcare needs or special developmental needs. We fund some programs that Laura works with directly that work with kin caregivers and grandparents raising grandchildren. We have some peer support programs that we fund. So all of these programs benefit from taking the standards training and implementing the standards within their work. So even if we are not directly funding them as an FRC or as a funded program through the Georgia Family Support Network, we believe that all of our programs that contract with us can benefit from taking the standards trainings and implementing the standards within their programs. Next slide. So late last year, the leadership in our agency had come to our then director, Natalie Towns, who had been the NFSN board chair for a while before she left our agency. She had been contacted by the leadership in our organization, and they wanted to possibly advocate for statewide legislation around family resource centers and potentially a state budget to support family resource centers. And so we worked together with our Georgia Family Support Network members who meet with us regularly in our committee work groups, of which Laura will talk about in a minute. And so we worked with them to develop what a definition of an FRC would be, so that we could drop that definition into the legislation. And so we drafted something, but we basically borrowed from the National Family Support Network. We had reached out to Andrew and Julie and had gotten some information about, these are some of the things that they put in. We reached out to some other states and got some information from them. And we drafted some language, and then we reviewed that with the membership of our Georgia Family Support Network. And this is what we finally came up with. So we said that family resource centers can be some of these things. They can be place-based, they can be population-based, they can provide these kinds of programs and services. Next slide. And then we also said that these are the service categories that potentially a family resource center can provide. For the purposes of our funding opportunity, which we'll talk a little bit more about later, for our first funding family resource center funding opportunity, we required our applicants to select from at least 2 of these service categories and provide at least 3 services. So they could provide 2 from one category and 1 from another, but we didn't want all 3 of the programs that they were going to implement to come from one category. So in the legislation draft that we had put together, and in the definition of a family resource center that we have now included in our Georgia Family Support Network bylaws, we didn't require that family resource centers provide any number of services. We just said these are the services that they could provide in order to be defined as an FRC. But in our funding opportunity, we did require at least 3. Next slide. And I think I'm turning it over to Laura now.
This is your last slide, actually.
Oh, that's my last slide. Okay. So a little history of the Georgia Family Support Network. We started relatively recently ago. It seems a long time. Seems like we've been doing this for a long time. But in June of 2018, we had actually, it was earlier in 2018, we had Julie and Samantha come to Georgia and provide a standards training. And then in June of 2018, we established the Georgia Family Support Network, and we had 2 of our staff, Laura here and Natalie Towns, who I mentioned earlier. They were trained as trainers of the standards. We had our inaugural convening of our Georgia Family Support Network in November of 2018. So we had developed a survey that was just a brief survey, and I think it's in one of the resources that's in the members only section on the NFSN. The survey was just basically asking, do you consider yourself to be an FRC? Do you consider yourself to provide family support or family strengthening programs? Have you heard of the standards? Have you heard of the National Family Support Network? Would you be interested in Georgia developing a Georgia Family Support Network? Would you be interested in receiving the standards training? So it was just a really brief survey, and it was just to get basically an overview of what the needs were in the state. We didn't want to start a Georgia Family Support Network if nobody was interested in participating. So we did sort of a landscape survey, and we got enough sufficient interest that people were interested in learning more about it, that they wanted to attend the standards, that they wanted Georgia to develop a family support network. And so we invited the people who had responded to that survey, we invited them to the inaugural convening in November of 2018. And in that convening and in a subsequent meeting, we developed our mission, our vision, our goals. We determined what work groups we wanted to create to be part of the Georgia Family Support Network. And we offered for people to come and, take the standards trainings. And so we launched our work groups in July of 2019. And then in August of 2019, we had our first of the several annual convenings that we've had. So as a full Georgia Family Support Network, we only meet together once a year. But work groups meet more commonly. And again, Laura will talk about that some more. And then starting just this year, October 1st of 2022, our first Family Resource Center funded cohort was launched. So we now have 8 Family Resource Centers that we are funding with those CBCAP dollars I mentioned. And so we are moving forward with that group. Now I believe I'm turning it over to Laura.
Yes, thank you, Deborah. I'm Laura Griggs. As Deborah mentioned, I am the state lead for the Georgia Family Support Network. That is part of my job within the Prevention and Community Support section at Georgia's Division of Family and Children's Services. So I'm just going to talk a little bit about the Georgia Family Support Network. Just kind of summarize, basically, we're obviously a network of organizations who are championing quality family support across our state. We encourage all of our members to take the standards training and to implement the standards in the work that they do with families. And then we also provide them with networking opportunities, tools and resource access, as well as continuing education and potential funding opportunities. Next slide. So you can see our vision and our mission up here. We envision a state in which every family is thriving and has access to a strong and effective family support and strengthening network. And our mission is to leverage those networks to strengthen practices and policies that champion quality family support. Next slide. So these are our goals and objectives, and I'm sorry if it's cut off a little for y'all. I'm not sure it is for me, but hopefully we can send these slides out afterwards. But basically our goals are to connect our members to one another to enhance their effectiveness and to ensure that best practices are fully implemented across our state, and that the value and impact of having a family support network in our state is highly visible and hopefully leads to increased support for our families. Our objectives are to increase the number of organizations in Georgia who are implementing the standards, and to increase the number of policymakers and funders who are aware of the network and who hopefully will invest resources in those organizations that are implementing the standards. And it's number 3, it's the third objective on here, but really it's number 1, and that's, to increase the number of families who are supported by quality family support programs. Next slide. So this is our structure. Deborah and I, as we mentioned, are with the Prevention and Community Support section of our state's child welfare division. And so we're the sponsor of the Georgia Family Support Network. Then we have our steering committee, which is made up of our staff, our prevention staff, as well as the co-chairs of our 3 work groups. And the work groups are obviously made up of network members. And you can see there we have 3 of them, 3 work groups: program and standards, strategic communications, and data utilization and evaluation. Next slide. So we have 2 different types of membership, really. We have member agencies and affiliated members. So member agencies are those who are providing direct services to families. And then within that designation, you're classified as either a family resource center member agency or a family support member agency. And for us within the GFSN, FRCs are self-identified as having multiple characteristics and providing multiple services within the categories that Deborah had talked about on the slide earlier in the presentation. Those categories were parenting and family support, access to resources, child development and educational activities, family economic success, health and wellness, and family engagement or community engagement. Next slide. And family support member agencies are very similar to FRCs, but they provide standalone family support programming within those same categories. And then affiliated members are those who don't provide any direct services to families, but they're committed to supporting families and the standards and the principles of family support in the work that they do. So for us, those would be people like Prevent Child Abuse Georgia or Georgia Family Connection Partnership, et cetera. Next slide. So these are our membership requirements. I'm not going to go through all of them, but the one that I wanted to highlight today is that we require at least 1 staff person from each organization to have gone through the standards training before they can join the network. And then we encourage the other staff at that organization, if they haven't gone through the standards training, to view the intro to the standards webinar, which is on the NFSN website. And I did just want to note that these membership requirements were all voted on and created by members of the Georgia Family Support Network. So there's obviously a lot more buy-in because they created them. And then every year at our annual convenings, we talk about whether we need to make any changes to those requirements. Next slide. So as Deborah mentioned, this year we were able to offer a funding opportunity specifically to family resource centers. And it's a 3-year funding opportunity, and an application for continuation will be required each year. But basically, we were able to provide up to $200,000 per award. We awarded 7. We have 8 FRCs in total, but 1 was a previous FRC. And they started October 1st. And we are requiring them to join the Georgia Family Support Network and to take the standards training within the first contract year. Next slide. So you can see the requirements there. Year 1, as I mentioned, take the standards training, join the network. In years 2 and 3, they will be required to apply the standards in their work and use the standards assessment tools, as well as to show improvement on at least one of the standards. And this is information that we typically share when we're talking about the standards, talking about the network, or trying to recruit new members. So we tell people kind of why we think they should adopt the standards and attend a training. And we always tell them it's a blueprint for implementing best practice. The training comes with built-in self-assessments that you can utilize. You can demonstrate quality. After going through the standards, you can see what work that you're doing is already, meeting standards and where you're lacking. The standards establish a common language. They create shared measurement systems. And then joining the network helps organizations develop partnership opportunities, and of course allows them to be a part of a statewide and then a national movement with the NFSN. And I am turning it back over to Deborah for the last few slides.
All right, thank you. So as Laura mentioned, when we developed the Georgia Family Support Network, we were really just offering an opportunity for the family support and family strengthening and family resource center providers in our state to come together to network with each other, to learn from each other, to learn from us, whatever technical assistance we could provide from the state office, to have access to free standards trainings. But because we weren't funding their services directly, we didn't want to make it a requirement as a Georgia Family Support Network member. As we built up our membership, we didn't want to make it a requirement for them to take the trainings or to implement the trainings. We did, however, at the encouragement of the members of the Georgia Family Support Network, we do require them to take the standards trainings for the in order to join. At least one person has to have taken at least the online standards training, the one that's offered on the National Family Support Network page, and then they have several months in order to get at least 30% of their staff trained in the standards. It's actually a year, I think we give them, right, Laura? And so we do require them, in order to be members of the Georgia Family Support Network, they have to take the training, but what we're not requiring is that they actually implement the standards. And so we encourage them to, once they've taken the training, to then implement the standards in their work, but we're not doing currently any monitoring of that. Laura is not overseeing that. She's just overseeing whether they take the training or not. And you can pull up, we did develop a Georgia Family Support Network webpage where we talk a little bit about what Laura just shared as far as how the standards can be applied in the work that our agencies are doing. In addition to, you can see there, focusing on families raising standards of practice. So we sort of talk about the reasons why an organization might want to take the standards, why it benefits the work that they do, it elevates the work that they do, it allows them the opportunity to have a shared common language when talking about this work. And if we ever were to be in a position where we could advocate on behalf of state funding, we thought that this put us in a great position. If we had a network of organizations who were already trained in the standards and implementing the standards, that positions Georgia to be in a better spot to advocate for state level funding. And so those are some of the areas that we encourage people to consider when we're asking them to take the standards trainings and join the network. Starting with our Family Resource Center, you can go back to the slides, Mary, thank you. Or Cheryl, I forget who's driving. As Laura mentioned, for our Family Resource Center grantees that started this year, we are requiring them to take the standards, and we will require them to implement the standards. We also fund some evidence-based home visiting programs, and we have required them to take the standards trainings. And then we also have a partnership with Georgia Family Connection Partnership. And they have a cohort of counties who are working with us to provide child abuse and neglect prevention strategies. And so we are up to 6 counties who are a part of that cohort at this point, and we have made that a requirement for those contracts as well, that they take the standards trainings and implement the standards. So we're looking for opportunities as our network grows and as we get more established. And certainly if we ever got to a position where we had some state legislation around this, we would definitely advocate more strongly for and require even the implementation of the standards. But so far we've just been requiring the trainings and then encouraging implementation of the standards. All right, next slide. So one of the things that we have also done as a network in order to promote the use of the standards and the implementation of the standards is one of our 3 working groups, the Programs and Services working group, developed a community of practice. And so in this community of practice, during each of the meetings, they will focus on one of the standards in the standards, and they'll break out into breakout rooms and have discussions about where have the organizations been utilizing this standard, and where has it shown foundational quality, where has it shown high quality. We actually had Julie come and present at one of the early communities of practice and talk about the standards and how they could be implemented. They take the self-assessment tool, and then they are having training opportunities where we invite people to come and offer some technical assistance or training related to each of the standards when they meet together. So that's been a great way to encourage members to learn more about the standards beyond just the training, and then how they can apply it to the work that they're doing. Next slide. And those communities of practice are quarterly, Laura, or monthly? I can't remember.
I believe it's every other month.
Every other month. Okay. So we're going to show you just a quick video that we put together last year. And this video is it's 3 of our member organizations that are a part of our Georgia Family Support Network. They happen to be 3 family resource centers, and that was because we developed this video when we were trying to get on the legislative session as a possible opportunity for legislation. So that's why it's 3 family resource centers, but they talk about how the standards benefit the work that they're doing, and essentially how using the standards benefits the families that they work with.
Well, the Georgia Family Support Network is relatively new for our state, and it is a way to bring together agencies and individuals who are serving families.
It is there to make sure that organizations within Georgia are ready to help and be supportive of the things that the family needs. The Georgia Family Support Network provides us with training and other different resources so we can be prepared to meet the parents where they are.
One thing that I love about the network is it's a way to adopt similar language that we all use with families, but our goal is that all agencies are delivering family strengthening and supportive services to families.
We are supportive of each other. You know, we get to know each other, the work that we are doing, and I'm sure if I am facing an obstacle, somebody else has seen it before and will provide some insight and some support. And we are also happy to provide skills and supports and ideas to others as well.
The standards of quality for family support is a set of standards that we utilize with the Georgia Family Support Network with common language and goals, and they center around the 5 protective factors. I think the family-centered approach helps because we partner with the family and we help them see their value and their voice be heard. And I feel like a lot of times the people that we work with don't feel like they're heard.
We get them involved, we get them engaged. And I think that's one of the cornerstones of the standards, is having families involved and engaged so that they can have ownership of what we're offering to the community.
If they are able to have a part of the process and determine how things are going to go for them, then they're being heard, and I think that helps to drive service better.
A family strengthening approach is where we meet the family in the place they are.
as staff, we do not want to be seen as the teacher, the boss, the leader. So approaching it that we're not the authority figure, but we're the partner.
Diversity, equity, and inclusion is mirroring the families that we serve within our community. We want to make sure that whoever we're serving, when they walk in the doors, they see pictures, they see me. Sometimes my son, he's younger, but he comes there in the evenings with me. So we want to make sure that there is a mirror image of the families that we work with.
There's a lot of things going on in our world right now that's really heightening our awareness of how important diversity and inclusion is. So we're respecting parents and families regardless of their situation.
We spent about a year designing a model and adapting the idea of the Family Resource Center to the cultural and linguistic needs of Latinos in our Metro Atlanta area. And then we opened on March 2020, in the midst of the pandemic, our first Family Resource Center. We call them CAFES, Centro de Ayuda Familiar y Emocional, Center for Emotional and Family Support.
Building community support means, as a community, identifying again, what are those gaps? How are we supporting families and children? Where are areas that we can improve upon? And then reaching out, kind of spreading the information to other stakeholders.
The Latino community in Metro Atlanta has grown by leaps and bounds, but services for that community has not grown in the same proportion. And for us to engage other partners that want to serve the Latino community was important as part of the design of CAFE. You know, not only that we could provide ideas in how to better serve Latinos, we do a lot of cultural proficiency work, but also allow other smaller grassroots organizations that might need a space to meet or might need, to find ways of funding, the work that they are doing. And we have provided that means and those opportunities for growth.
Evaluation is hard, especially in the prevention field, because we're hopefully preventing something that hasn't happened yet. And with several of our programs, we have evaluation mechanisms in place. But I think with the Georgia Family Support Network, evaluation is going to be better for us, because now we're going to have these standards of quality that we're trying to adhere to and meet and attain the top tier.
The Family Support Network standards, there's actually a whole section that deals with evaluation and helps agencies walk through some practical steps they can take to be sure we are capturing data.
I think it is beneficial to Georgia to have a family support network statewide, because we now have a way to network. There may be somebody out there doing what we want to do or doing it differently, and it's just a way for all of us to be on the same page and have a group, to feel like we're not alone, because sometimes we get in silos and we feel like we're doing it all by ourselves, when in actuality, Georgia's a huge state, so it's being done all over Georgia.
Thank you. So as you can tell, that video was shot right at the height of the pandemic. So that's why there's several masks that you saw. But we were able to highlight the great work that some of our members do. And also they were able to highlight on our behalf the benefits of utilizing the standards. So some opportunities for this year for how we can continue to move this work forward in our state is, as we've already mentioned, we are requiring our funded family resource centers to implement the standards, in addition to just requiring them to attend the standards trainings. We are going to be developing an evaluation of our Family Resource Center program specifically, but we also want to evaluate the network. And so we are going to be opening up the opportunity, if there are any members of the Georgia Family Support Network who would also like to participate in the evaluation, that they'll be able to opt into that evaluation. So it'll be a requirement for the organizations we fund, but it will be an opportunity for those who are in the network who are not funded by us to be able to participate in the evaluation. As the network grows, we're hoping that we'll be able to require more, to require them to implement the standards once they've attended the trainings. We're also working to identify some more community-based standards training. So right now we have 6 trainers in the state of Georgia, but more than half of those are state employees. They work in our section, and then the other 2 are community providers. And so we're wanting to identify some more community-based trainers to become trained trainers. And we're going to continue to recruit GFSN members. So that video is one of the tools that we're going to use to promote the network and to promote the standards and request new recruitment. And then continue to identify ways to fund FRCs, either through federal funding, through grant funding, or what we're hoping is eventually that we'll be able to identify some state funding specific to family resource centers. And also to increase dedicated staff support. So right now, Laura is doing a whole lot. She is the Georgia Family Support Network state lead. She oversees the network and all of the meetings and the standards trainings and coordinates all of our trainings and all of that. And now she's also leading up our Family Resource Center program. She's partnered with one of our other program specialists who will be managing some of those contracts, but Laura will be the state lead for that. I provide assistance. Karsten, once he's got his footing a little more, will help to provide some assistance, but really it's been falling largely on Laura. And Laura also, this is only part of her job. So she also has quite a few other programs that sit under her. So we are looking to hopefully identify a way to have dedicated staff time specifically to the Georgia Family Support Network and the Family Resource Center program, and not to have Laura have her time so split. So those are opportunities for the future for us. And I believe that is our last slide.
Thank you so much, Deborah and Laura. What a great presentation. Thank you so much for sharing your valuable work in Georgia and your continued work with the standards to provide continuous quality improvement. I'd like to mention now that we do have some time for questions and answers. So if you'd like to be putting those questions into the Q&A section of the panel, I'll go ahead and get started with our first one. There was a question about where did the Promoting Safe and Stable Families funding go?
So the funding hasn't gone anywhere. The funding is still in our agency. It's just there was some realignment in our prevention section. So the PSF, PSIF, we call it in Georgia. The PSIF program had been under our section and reported to our section director, but that person who oversaw that program has been pulled out and is now reporting to someone else. So we'll still be in alignment. We'll still be working with them. They still fund some of the things, some of the work that we do, and so we'll still be in close coordination with them, but they don't directly report to within our section anymore.
Thank you.
Uh-huh.
Okay, so there's another question. What evidence-based home visiting programs take the standards?
So we have offered it to all of our evidence-based home visiting programs in Georgia. We have several of the program managers. In fact, one of the women who was on the video, she oversees a Healthy Families home visiting program as part of her work. And so several of the folks who do home visiting are members and take the standards trainings. The ones that we fund that are required to take it are Healthy Families and Parents as Teachers, and we have required them to take it. The Healthy Families Georgia Coalition, which there are, I forget how many exactly, but there are probably about 20 Healthy Families programs in the state of Georgia. They wanted to require all of their Healthy Families home visiting providers to take the standards. So we actually had two separate standards training specifically for Healthy Families home visitors. And then when the Parents as Teachers people found out about that, then they wanted to train all of their Parents as Teachers home visitors. And so Laura can probably speak more to that if that happened. I can't remember now.
Yeah, so yeah, that's correct. They did. But I also just wanted to add there's actually a crosswalk between the Parents as Teachers and the standards on the NFSN website. It's with the old version of the standards, but I think it's still probably pretty relevant. So I can put the link to that in the chat.
Yeah, and that was done by someone in our state. It's actually Healthy Families, I believe. Crosswalk between Healthy Family Standards and, isn't it?
It's PAT.
Oh, it is. Okay. And that was developed by somebody in Georgia who provides training and TA and is one of our standards training. So she saw the alignment between the two and created the crosswalk. And so it's been added to, and she ran it by Andrew before we finalized it. And so that's a great point, Laura.
All right, thank you so much for that. I have another question. How do we receive information on becoming a trainer? I'm not sure if this is state specific or if they're like in the state of Georgia, how would they go about that? Or if that's a NFSN question. So I'll let you all take that one first.
If you're in Georgia, you can just reach out to me. I have a very short list of people who are interested in potentially being a standards trainer. And we're going to talk about that, I guess, kind of internally in the new year. But we definitely want, as Deborah mentioned, more community providers to be trainers. So if that's something you're interested in, please email me. I'll put my email in the chat. If you're not in Georgia, I believe that's very state specific. So I guess you could reach out to the National Family Support Network. Maybe Mary could direct you to someone from your state that you could talk to about that.
Yes, the Standards Training of Trainers program, it builds the capacity of member networks of the National Family Support Network and the California Family Strengthening Network to be able to conduct the standard certification trainings. And that program is designed to support networks to take on a unique and an essential and ongoing role in their geographic areas for enhancing quality work with families. Each in-person or virtual training of Trainers Institute has a limited number of participants, and they're selected through an application process. You can find more information on the National Family Support Network. If you'll just click on Standards of Quality and then move down to Training of Trainers program, you can find all of the information there, including future dates that are upcoming for those programs and an application.
We had at one time had 10 folks trained in Georgia, and then just through attrition, people moving on, we're down to 6 at this point. So we are interested definitely in increasing our numbers again.
Okay, so I've really enjoyed the presentation, but could you provide us maybe with some lessons learned, maybe something perhaps that you did in implementing the standards, which maybe didn't work out, and how you worked through that process?
Laura, you want to take that one?
I was trying to think. You could go first if you have something.
Yeah, I'll say, because we've been a relatively new network, and because we didn't want people to feel like, oh, we start this network and then right away immediately there are all these requirements to be a member. We didn't want it to be burdensome. We really wanted this to be of benefit to the people who join the network. And so we really did limit the requirements to be a member to the bare minimum. We were trying to not make it a really heavy lift for folks. And so, you know, we had a good number of people who were taking the standards trainings and requesting the standards trainings, but then I'm not so sure that many of them did anything with them after they had attended. Like once they got their certificate, they were like, okay, well, I did that. And there was not much integration into the work that they did beyond that. That was one of the reasons that the Programs and Services Committee started the communities of practice in order to help people see how they could implement the standards more broadly in their work. And so I would say that would be one of the lessons, is maybe if we had thought through that at the beginning a little more, maybe we would, or had done more promotion at the beginning as to why you want to take the standards trainings, and not just so that you can become a member, and how they can be useful to you might have been helpful.
Yeah, I think that's a good one. And the other thing I thought of is just as far as recruitment, or getting people to either join the network or to take the training. We have found that at the end of the standards training, talking about the network and encouraging people to invite the rest of their staff to the training has really increased our membership in the GFSN, as well as the people who are signing up for the next standards training. So just using the training itself as kind of a recruitment tool, I think has been really successful for us.
Great, thank you so much. And let's see if there's, I'll give you a few minutes to perhaps put some additional questions in. Okay, let's see, here's another one. An entirely new kind of parenting education that reaches everyone, everywhere, could be an extraordinarily powerful kind of prevention. Do you think that public health authorities should be developing this kind of parenting education?
Well, I feel like maybe that question is above my pay grade, but I'll take a stab at it. Yeah, I think we have seen through the pandemic, I think one of the benefits, or not benefits really, but one of the things we learned is that primary prevention programs really helped families through that time. And we didn't see the huge increase in child maltreatment cases that everybody was anticipating during the pandemic. And part of that was because of the supports that states were able to offer to families through the ARPA funding, through flexibility in our CBCAP funding. We were allowed to use some of our funds for concrete supports for families. There were the concrete supports that came from the federal government in terms of the child care tax credit and the I forget what it's called now. It's not called that. But the funds that were given to parents from the federal government. So I think that we learned some lessons through this pandemic, that both at the federal level and also at the state level, that when parents are given the supports that they need, and given them globally, not through because they've already fallen into the system, but if they're given to all parents to strengthen them, that those benefits really do make a difference for families. So I think I answered your question. I'm not sure.
I would just say ditto. What she said.
All right. Thank you, ladies, so much. I've really enjoyed your presentation. I love the work that you're doing there in Georgia. I love the standards. So I love when people are implementing those and working with families. So a great way to connect with us is through our webinar Wednesday. You're here with us today. Just want to let you know that next week's webinar Wednesday will be covering uncovering America's best kept secret, family resource centers and family resource center networks. And we encourage you to check that out. If you're interested in learning more about the standards and becoming certified, I encourage you to go to the certification training page on our website where you can see upcoming training opportunities. Additionally, this is a great place to see if your state already offers the standards training, and you can also find information on how you can reach out to them to register if they do. In the standards, we talk about the value of parent voice and involving parents in a meaningful way. The Developing and Sustaining Effective Parent Advisory Committees training is a unique and highly rated virtual training for program staff to maximize the great potential of parent advisory committees. This training is co-trained by an NFSN staff member as well as a national parent leader. On this slide, I've provided my contact information as well as that of my colleague, Julie Matusik, who is the Senior Manager for Standards Training and Implementation with the NFSN. Please feel free to contact us with any questions that you may have. Today's PowerPoint, as well as all of the handouts and the recording of this webinar, will be available on the NFSN website by tomorrow afternoon. I do want to mention that as you're exiting the webinar today, we ask you to complete the evaluation on your way out. We very much appreciate your valued feedback as it helps us inform future webinars. And it's also exciting to see what your next steps are. Thank you for being here today, and I hope you have a lovely rest of your Wednesday.